Hello, Nitin. No, they called me. But then Anand said he's 1.5 hours. There, Nitin, there's enough time. There's enough time. Let her present. So laser vision corrections have come a long way from 1973. Started off with PRK, which was approved by the FDA in 1995, and LASIK was approved in 1996. And surface ablations continue to evolve. From the 1980s, when it was called the PRK, with no mitomycin was used, it was minimally invasive, but there was a lot of pain, there was haze, there were regressions, and hence came LASIK. With fast recovery, pain was almost nil just for a few hours, but there were problems like flap complications, ectasias, flap-induced aberrations, thin corneas could not be treated. And of course, the cost and the maintenance of the microkeratomes. Now, Dr. Nitin Balkrishnan, who is also a co-instructor here with me, is one of, I can say, my guru who taught me PRK, LASIK, and I remember the times when we were breaking our heads with the microkeratomes not going forward, backward, all these problems that we used to have, the maintenance issues, and of course the cost of the blades. So we came back to the surface with a variety of procedures, that is PRK with mitomycin C. The mitomycin C helped in reducing the haze. There was also the LASIK, that is epithelium is loosened with the help of alcohol, and EpiLASIK, where a microkeratome was used. EpiLASIK, of course, is not really done today because the flaps were very thin. There were a lot of flap wrinkles, flap complications with EpiLASIK, and hence it was not something that we could do. So now in alcohol assisted, this is where the alcohol is used, and it is of course diluted. We use the corneal trephine, which is about 9 millimeters, keep it there for some time, and then the epithelium just comes off. The Merosol sponge is used, which is dry, so that it helps in removal of the epithelium like this. So this was the one of the methods that we started doing PRKs and surface ablations with. One of the problems with this was if the alcohol leaked, then there was a problem with the stem cells at the limbus. The other procedure which came in was the Amoils brush. This is the brush which rotates and revolves and helps in the removal of the epithelium. And you can make out that the epithelium is off because it gives that particular dry surface that you can see on the cornea. And that's how we knew that the epithelium was off. This was the Amoils brush, which did away with the alcohol and its problems. The other very innovative and a very good procedure now is trans PRK, which the excimer laser itself removes the epithelium, and then once the epithelium is removed, about 60 microns of the epithelium is removed, and then the laser is done and the mitomycin is used. So this is how the trans PRK is done. And of course, with any surface ablation, you need to put a contact lens because the epithelium is off, and we need to make sure that it heals. So the contact lens nowadays we place at least for about a week, so that there is a proper healing. And it has been seen that normally the epithelium would heal in 2 to 3 days, but if you remove the contact lens earlier, it can cause a little bit of haze and things like that. A newer method is EBK, which is Epi-Bauman's keratectomy, which is an equipment like this, and it helps in removing the epithelium as well as the Baumann's, and in a very smooth manner. So this is one of the new techniques which has come in. Of course, I don't have any experience with it, but there have been studies which have shown that the Epi-Bauman's blunt keratectomy was compared with the epithelium removal of the with the help of alcohol, and it was seen that this technique may minimize the post-operative pain, accelerate re-epithelialization, and offer earlier visual recovery compared with the alcohol removal. And this was one of the studies which was published in the Cornea Journal in 2019. So the advantages of advanced surface ablations are: it is safe in borderline corneas, there is no effect on the posterior segment, there is less thinning because you have more of a residual bed, there is less dry eye, and the retreatments over the LASIK flap are also possible, and it can be combined with a corneal cross-linking. So these are some of the ways in which we are able to remove the corneal epithelium, and like I said, now it's the Epi-Bauman's which has come in. So all these removal of epithelium per se is where the evolution of surface ablations is going, and there are newer and better methods coming up time and again. So the evolution of the surface treatments, as you can see, PRK was FDA approved in 95. It was seen that there was epithelial injury causing post-operative pain, late visual recovery, and of course the risk of haze. And that's why came in LASIK, which was approved in 1999. Intrastromal incisions, the LASIK caused intrastromal incisions into a deeper plane in the stroma, causing a risk of corneal ectasias. It was unpredictable sometimes, and flap-induced aberrations were there. And that's why we came back to the surface with advanced surface ablations. Thank you very much.